All right, guys, welcome to the next section of the presentation. This is going to be a really quick look at EBOO. So an intro to EBOO. First, we'll start off with our disclaimer. As you know, this whole series is for educational purposes only. It's not intended and does not provide advice or services, including medical, psychological, legal, or health advice. So what is EBOO? Kind of the new kid on the block. It's extracorporeal blood oxygenation and ozonation. It's elevating a major autohemotherapy, MAH, with a different approach. So I said new kid on the block, that's more applicable to the US. It really started in Malaysia 22, 23 years ago. It's now gaining US attention at the clinic and a lot of times the patient level. You'll have patients advocating or inquiring about, do you offer EBOO? So it's considered the world's most advanced medical ozone therapy. Again, I said the word different approach to major autohemotherapy. Here's why. So you're looking at bilateral access. You're drawing blood from one IV and delivering treated blood into a second IV. It's a closed loop system. I have in here that it's like dialysis, but just in terms of that closed loop system. Now, and in terms of we are using dialysis filters. Now, when you're looking at this, you're treating more volume of blood in a 50-minute treatment time than other MAH, major autohemotherapies. It's about 2 liters of total blood. And you're using a concentration of ozone that's low. So standard is 3 gamma versus higher dose therapies that are 40 to 70 gamma. So again, a different approach. Now, for those of you that like math, if you're looking at this rate below, this is how we get to our total dose of ozone. So when you're combining that ozone and oxygen gas and you're looking at the flow rate, the total volume, you get yourself your total dose of 150,000 micrograms. Now this visual is a little hard to read. As you can see, the bottom got cut off. So that should say blood in, the top port should say blood out. So when you're looking at the tubing and diffuser setup, where it says blood in, that's where you're going to connect the tubes, blood out, etc. Now, this is a dialysis filter. So with that, we use it differently, which the next slide will highlight. The perforations are so small that they do not allow red blood cells or blood cells into the straw. Okay, as you can see, the blood stays on the outside, on the peripheral. Now, from the top, you put in the ozone and oxygen gas mixture. So that is going to be diffused out of those tiny, tiny perforations at a high percentage of those blood cells. So in some opinions, this is creating almost a systemic hyperbaric effect. From this slide, you can see the typical hemodialysis use of a filter versus an EBOO diffuser. Notice my language is very specific there. One is called a filter. The second we're calling a diffuser. So again, you are diffusing ozone and oxygen gas to the blood that stays on the outside of those cells, and then you're returning super oxygenated blood out to the patient. Now, why EBOO? A lot of you are already familiar with high dose and 10-pass, high dose therapies, and want to know the difference. So if you're looking at this slide, you can come to your own conclusions. Again, there are differences. The amount of blood treated, there's a ton of differences, but some of the main ones, the concentration. The concentration is way different. And then 2 IVs versus 1 IV can impact EBOO recommendation. So as I just said, EBOO recommendation, does it replace those high dose therapies? Not necessarily. So if you have a patient evaluation of vein access and you say, oh, your veins will not, you don't have good veins to not only have the procedure started, but you also got to think through these veins enduring for 50 minutes. And so there is a differentiator between a high dose IV recommendation and an EBOO recommendation just off of vein evaluation. So HD will remain the best option for those with fragile vein access. Now, also you're thinking through titration. How are you getting someone to the EBOO recommendation? A lot of people will go from standard to high dose to an EBOO recommendation. So if you have that availability in your clinic, that is something to consider. Now, Treatments needed and frequency, always talking once a week in general, and then depending on the health condition, you're saying 3 therapies minimum, 2 therapies minimum, 1 as needed. You might hit that optimization patient who just comes in 4 times a year for an EBOO. All right, I know this was brief, but any other questions, I'm happy to answer. This was just your quick look at EBOO. Thank you for spending time with me today.